The number of paratransit vans and buses like these used to transport passengers on the highways every day is on the increase. Along with the increase in vehicles comes a greater chance of breakdowns and or accidents. Due to the special needs of the elderly and handicapped passengers who most often use these vehicles, efficient and safe methods of evacuation are needed should a breakdown occur. This video is designed to train 16B2 and Section 18 project drivers and related personnel. The information contained in this video is intended to identify, develop, and implement an effective evacuation plan. The Secretary of Transportation has stated that the #1 priority in any transportation program is safety. The Arizona Department of Transportation and the Phoenix Transit System share this priority. This video will make you more aware of proper evacuation procedures and how those procedures can be applied within your operation. When transporting passengers, any number of problems may occur. Each situation you are confronted with will dictate whether or not evacuation is necessary. In the event the vehicle is stopped because of an accident, mechanical failure, road conditions, or human error, it is up to the driver to determine immediately whether it is safer for passengers to remain in the vehicle or to evacuate. To aid the driver in this decision, it may help to know some situations where evacuation is necessary. If the engine or any part of the vehicle is on fire, passengers should be evacuated immediately and moved to a safe location 100 feet or more away from the vehicle. The passenger should remain at this location until the driver determines that all danger has passed. Being near an existing fire and unable to move the vehicle away, or near the presence of gasoline or other combustible material, is considered danger of fire and sufficient reason for evacuation. In some situations, evacuation is mandatory. The driver must evacuate the passengers when 1. The vehicle stops in the path of any train or stops adjacent to any railroad track. 2. The stopping position is not stable and may change to further endanger the passengers. Or 3. The stopping of the vehicle is such that there is danger of collision with another vehicle. In normal traffic conditions, the stopped vehicle should be visible from at least 500 feet or more. If the vehicle cannot be seen from this distance, such as over a hill or around a curve, it should be evacuated. Remember, safety of the passengers is of the utmost importance, and the driver must be certain that any evacuation is carried out with this in mind. Sometimes situations arise which can make evacuation difficult. During an emergency, passengers may panic, and the doors may jam if everyone tries to get out at the same time. In order to avoid this situation, all exits should be clearly marked. It is up to the driver to instruct his passengers on the location of these exits, how they operate, and in what order the passengers should exit. Passengers should also know the location of the fire extinguisher and first aid kit in case the driver is injured. As a result of an accident, doors may become blocked or inoperable, making evacuation difficult or even impossible without the help of emergency rescue personnel. In these cases, other possible exits must be considered. The windshield is one possibility. In most vehicles, the windshield can be removed by exerting pressure in the corner of the glass. This can normally be accomplished by kicking this area with your foot. The windows are another possibility. In vans, the windows are not designed as an emergency exit because of their relatively small openings, but in emergency, these windows may be broken to provide limited access. The side windows on small buses are larger and provide more room for escape. These windows should be marked as exits, along with instructions on how to operate them. Traffic may also be a problem when trying to evacuate passengers from the vehicle. If the vehicle is stopped on a busy street during heavy traffic, it may be necessary to have someone direct traffic until the police arrive. And finally, bad weather can make evacuation difficult. Wind, dust storms, ice, snow, and freezing temperatures, even extreme heat, are all possible problems. Should the driver find it absolutely necessary to evacuate under any of these conditions, extra care should be taken to protect the passengers during evacuation. They should then be removed into a place sheltering them from the elements. In some cases, it will be necessary to call for emergency rescue assistance when an injury accident occurs. The location of the accident will determine the response time of the emergency units. Accidents occurring in the urban areas are normally responded to within minutes. However, it is not uncommon for units in the rural areas to take 30 minutes or more to arrive. In either case, the driver should take control of the situation until help arrives. Once the police and paramedics reach the scene, the driver should inform them of the situation and allow them to perform their duties. But the driver should remain nearby in case any additional assistance is needed. When developing an effective rescue plan, there are some basic steps to consider. Among these are the following 8 activities. Adequate preparation, careful and immediate problem assessment, response to the situation, hazard control procedures, emergency care for the passengers, disentanglement from the vehicle or from personal restraints, removal and transfer of the passengers, and finally debriefing and documentation of what occurred. Let's take a look at each of these activities a little closer. Preparation. The first step in any rescue plan is preparation. It's important to have evacuation procedures outlined so that, should an accident occur, you're ready to respond effectively. All drivers in your agency should be well trained on these procedures and review them regularly with their passengers. The driver should also be familiar with his individual passengers and their disabilities. This is especially important should the rescue personnel need specific information about a passenger's condition. It is the driver's responsibility to know the exact number of passengers on board. If the passengers are clients of a social service agency, additional information can also be obtained from the system operator over the van's two-way radio. This kind of preparation will help everyone involved understand what is expected and how to respond in an emergency. Assessment. The first thing the driver should do when an accident occurs is to assess the entire situation. Is anyone injured? Is evacuation necessary? What's the condition of the vehicle? These kinds of questions should be asked so that the driver is aware of all conditions before taking any action. If, after doing an initial assessment, the driver determines he needs more help, he can call on his two-way radio. If the radio is not working, a passenger or someone nearby can be sent for help. The information relayed about the accident should be as specific as possible so that the necessary rescue units can respond. Response. When responding to a paratransit van accident, additional rescue personnel may be required. The elderly and handicapped passengers in the vehicle will most likely need special attention and extra assistance during evacuation. Be sure to inform emergency personnel of any special assistance that is needed. Hazard control. Traffic-related hazards may be handled by police officers, while non-traffic hazards such as fire or unstable vehicles must be handled by firemen. Should you, the driver, find yourself confronted by a hazardous situation, don't try to handle it alone. Evacuate your passengers as safely as possible and wait until help arrives. Emergency care. Should any of the passengers require emergency care, rescue personnel should be called immediately. Unless the situation is life-threatening, the victim should be left in the vehicle until trained rescue personnel arrive. In the meantime, the driver should try to determine the extent of the victim's injuries. Each victim's situation should be evaluated to determine what would be best for that person. In critical situations, where immediate removal is necessary, extra care should be taken to prevent further injuries. Basic emergency care needed by elderly and disabled passengers is not unlike that provided to other accident victims, but the determination of their injuries is much more difficult. Where a non-disabled person can complain of pain resulting from injury, a paraplegic may have injuries he or she is not even aware of. This is why passengers should be left stationary unless absolutely necessary. Disentanglement. Disentanglement may require doing such things as cutting seat belts, removing seats, and/or other impairments. In paratransit van accidents, all of the above may be necessary, as well as disentanglement of passengers from torso restraint devices, wheelchair lifts and ramps, or other similar equipment. Torso restraint devices can be removed by a seat belt cutter. If possible, the wheelchairs should be freed to facilitate the evacuation. Wheelchair lifts and ramps often become inoperational during an accident and do not work. If the lift is hydraulically powered, it may be moved with relative ease by using the manual release to release the hydraulic pressure. Removal and transfer. There are several methods of evacuating wheelchair passengers from paratransit vans. If lifts or ramps are operational, they may be used in the regular mode. If the lifts are inoperative and ramps are not readily available, the driver, along with one or two other persons, may lift the wheelchair passenger while still in the chair. Check to be sure that the door is wide enough for the wheelchair to avoid it becoming wedged and causing further delay. It is important to carry the wheelchair tipped backward, as this provides greater protection to the passenger. If the wheelchair is too heavy to lift, another method is to lift the passenger out of the chair and, with the help of others, carry them off the vehicle through the nearest access door. The driver should ask the passenger which is the best way to handle him or her and proceed accordingly. This method can only be used if you are of sufficient size and strength to carry the passenger. If you find you cannot carry the passenger, one of two methods can be used. The first is to lower the passenger to the floor and use the one-man drag method. The second method is to carry the person by draping the passenger's arms over your shoulders with the passenger facing your back. This is probably the easier method of the two for carrying a disabled person. Because some elderly and disabled passengers may have difficulty communicating injuries, you may find it best to immobilize and secure these passengers until trained personnel arrive. Debriefing and documentation. Following each accident, agency personnel should be debriefed on what occurred. Some of the things to go over should include what kinds of training might increase the preparedness of rescue personnel, what special equipment might have been useful if it had been available, what new techniques were improvised, and what more could be done to assist the emergency rescue personnel. The agency personnel should also go over the driver's written report explaining the details of the accident. Although all rescue personnel have had many hours of training in emergency techniques, each accident or incident presents new problems. In an effort to assist these personnel to better perform in emergencies, it is up to you to take preventative measures before an accident takes place. One of the first things you as the operating agency can do is to contact the local emergency units in the area in which you operate and give them some information about your agency. Among the areas you should cover are the various types of vehicles in your fleet, the service you provide to your passengers, and the routes you utilize each day. It would also be helpful to provide them with specific information about your agency, including its name, address, a name and phone number of someone to contact within the agency, and the characteristics and number of passengers transported on each vehicle. As far as preparing for an emergency within your own operation, you should first equip all vehicles with two-way radios and instructions on their use. These can be used by the driver or passengers to call for help, or by the rescue personnel to speak directly to the agency about an injured passenger. It would be helpful to have a one-page summary of each of your passengers' characteristics. Along with name, address, and birth date, you should include such things as a physical description, including medical conditions and any unusual characteristics they might have, as well as names and numbers of doctors and persons to notify in an emergency. Any other special information which rescuers should be aware of should be included in this summary. And finally, as an operating agency, you should regularly schedule safety training sessions with your drivers, dispatchers, and call takers. Drivers who have had experience in staged emergencies through such sessions will be able to respond more effectively. They will also be able to assist emergency rescue units by identifying known physical characteristics of their passengers and the support they normally require. Because evacuation techniques vary, depending on the situation, some general policies should be adopted to prepare your staff and passengers. You should start by developing a basic evacuation procedure, one that will allow the drivers and passengers to be aware ahead of time on what procedure to follow. Inform passengers and then review the procedure a minimum of once per month. Pamphlets on proper evacuation techniques should be given to each passenger, and extras should be available or posted in the vehicle. Next, you should train your driving staff on the evacuation procedures. An intensive 2 to 3 day training session should be mandatory for all drivers with a refresher or actual practice on the procedure each month. You should also inform the local emergency units in your area of your policies and procedures. They should be briefed on the important aspects of your agency so they too can be better prepared to help you in an emergency. And finally, an evacuation review committee should be formed. In case of an actual evacuation, this committee would review procedures, evaluate them, and present ways the procedure could be improved. These revised procedures could then be incorporated into staff training. We hope these evacuation procedures will never be required. But in the event of an accident, having a well-trained staff can be a lifesaver.